And welcome back. Well, do you have chronic sinus problems? A lot of people assume it's just something they're going to have to live with.
But now there may be relief for that pressure and pain, and all it takes is a simple visit. Is here from Advent with more. Welcome back to the show, Doctor.
Thank you.
Nice to have you.
Nice to be here.
Good to see you. Okay, so a chronic sinusitis, that's what we're talking about. Ways are getting those sinus problems. How common is that?
Real common. Common. So about 10% of the population deals with that to some extent. So like a chronic infection that's there and doesn't go away. And then about that same percentage of folks, so another, basically 10% has issues with repetitive infections. So they can go away, but then they're back again, in a month or two, and it's sort of a repetitive cycle.
Is there something that these people have in common that makes them more prone to sinus infections?
Yeah, the number one sort of tying factor in as far as trouble goes is narrowness as far as the sinus passages go.
Okay.
So the sinuses are just air-filled passages in the skull, and they've all got teeny little openings into the nose. If those openings are closed or too narrow, then that creates trouble. If they're closed, then you've got the chronic sinus infection. If they're too narrow, then you've got the repetitive infections. And so it's just an uphill battle on a consistent basis that they're dealing with.
So clearly something needs to be done. I remember that I know you brought along this contraption here.
Yeah.
You kind of pioneered this balloon rhinoplasty or sinuplasty here in Wisconsin.
Yep. Yeah.
And now you're kind of doing something new with it again.
Sure. Yeah. So I mean, this is that balloon, and I don't know.
It's a little guy.
Yeah, it's a little guy. So this is the thing that we keep talking about. But that's the little angioplasty balloon. It is, and I've inflated it already, but it doesn't give. I mean, so when we inflate what we do is we sneak this up into the natural sinus opening and expand it, and it expands the sinuses, and so it microfractures the bone, creates an opening that is now there that wasn't there before, and so we're hitting right at the heart of trouble and getting those areas open.
And that's done right in your office.
That's the new twist. So the new twist. So initially, and I still do plenty of these in the operating room, so in a hospital or a surgery center. But what we've been moving to sort of here recently, last year or so, is being able to do that in the office, which is it's a game changer.
Yeah.
And so what we're doing is being able to do that under local anesthesia in the office. It's kind of like going to get a filling done or something like that. So I mean, it's not something you want to rush to do every day, but as far as procedures go, this is something that's pretty quick. Takes about a half an hour or so to do. Makes a permanent difference, and you can just go about your life on the back end.
Well, it's fantastic from a pain management standpoint. I would think people would have to take much fewer, if any, pain medication. It's something then that the recovery time is so much shorter than going to the hospital. What all takes place during this procedure? I know that we have a visual example. You're going to kind of walk us through
animation.
it.
Sure.
Yeah.
So basically, this is our friend here who's got a skull in his head. So that's showing the sinuses. So that's getting creepy. But no, anyway, so his eyes you see up high there, and then this is the inside of the nose. It's a little catheter. This is the same thing I was just showing you, and what we're doing is we're finding the sinus. That where that catheter is right now is where it's tight, and that's a little lighted wire. So you can see on what we're doing is getting into the sinus with that little wire, so we know where the opening is, and it just lights up literally. And then what we do is we put this very balloon I was just showing you into the sinus itself. Find the right spot, get that balloon pulled back to the right spot, expand it, so now the opening is open. So that's the relief, and people literally feel that relief. I mean, it's in the moment. You
almost
feel
instantly
just feel like something's open that was previously closed, and then we come out, and so that's it. I mean, that's all there is to it.
Are people surprised that can be a permanent fix?
Yeah, I get this question all the time.
Yeah, because I would think you'd have to just keep doing it.
The deal is we're not just sort of pushing around soft stuff. It is in the bone. That's a bony opening that's too narrow, and we're literally expanding that opening. So this balloon I brought in is 6 millimeters. If somebody's having trouble, their openings are less than a millimeter. So that's a huge difference. It doesn't seem like monumental, but those openings, it's a big time change, and about 98% of the time, once we make those openings open, they're good for the long haul.
Do you think most people are candidates for it if they're having a chronic problem?
Yeah, I mean, I'd say this is one tool and one option for folks who have issues. It's not the only option that's out there. If somebody's having an issue, there's just no sort of reason not to get it checked out. So we've got such low-key options nowadays, and we can move up the ladder. I mean, there's some folks who this isn't going to be enough, or it's just not the right fit.
Clearly, the important step is getting evaluated first, but does insurance cover this?
Yep. So that's also been a big change over the last year or so, is there are new, they're called codes, which allows us to do it in the office and allow the insurance companies to reimburse for this. So this is covered, and so again, sort sort of, yet again, not a barrier towards getting something done.
That's great.
I think it is great. A big relief for a lot of people who suffer out there.
Sure.
So I want to make sure everybody has the information for Advent so they can come in and see you there and find out if they are a candidate for the balloon procedure. Again, Advent is located on Mayfair Road in Wauwatosa. The phone number on your screen is 414-771-6780. You can call for an evaluation or visit their website at advent.md for more information too. Thanks so much for being here.
Yeah, thanks for having me.
Nice to have you as
Thank
always.
Great stuff.
And stay tuned.